What's going on, guys? Everybody's favorite, right? Selfie video in the car. Who doesn't hate selfie videos in the car? But here's the thing. I've got about 5 minutes before my kids get off the bus. I'm sitting here waiting. I just need to get this recorded so that I could share these ideas with you guys. So stay with me. I posted yesterday, I think, a comment about a $2,000 a month package. You limit it to 10 patients at any given time. You don't take on a new patient until a patient is discharged. And the idea being that at $2,000 a month, $240,000 a year, what is the level of experience you can provide your client? I think you can provide a pretty amazing experience at $240,000 a year when you're looking at limiting your exposure to 10 individuals at a time. So what would something like that look like as a hybrid model? How can we incorporate third-party payer reimbursement, insurance reimbursement into that package? I'm going to go with the most simple, basic payer we all know and love, Medicare. And so let's take a classic scenario. And this is an individual that I've treated multiple times over the years. He's a Medicare beneficiary. He's retired. He was a banker in the banking finance profession for decades. He's got a house in Naples. He's got a house here in Ohio. He's a snowbird. I mean, we all kind of know this individual. He loves tennis. He plays a little bit of golf. He wants to stay fit. He and his wife, they're empty nesters. The kids are all grown. They're adults. They have their own jobs. And the reality is they're sitting on a very comfortable financial situation. And so he deals with some persistent low back issues and some right shoulder problems. He certainly would benefit from a covered service in the form of a Medicare evaluation, PT evaluation. He would benefit from a covered service in the form of me developing a plan of care, giving him some education, some training. And he certainly doesn't have any cognitive deficits, right? No real medical complexities. He's not diabetic. He's not hypertensive. He doesn't have any of the other common issues we see in Medicare beneficiaries. He's really a very fortunate individual who's doing great. Now, the thing is, he wants to do better. So how can I provide him with the experience that he wants, the experience that really he deserves, and he's able and willing to pay for? So that's where we come in with the hybrid model. And that's where I say, I don't care how much money you have, nobody wants to feel like they're being taken advantage of. Nobody wants to feel like they're being cheated. Nobody wants to feel like they're being gouged. And so while he has Medicare coverage, he should have the right to use the Medicare coverage for what it was intended for. So this is what a situation would typically look like for something like this. He reaches out to me. He's like, hey, Tony, my shoulder's bugging me again. I'm in Ohio. I'm going to be here for a couple weeks, maybe a month or so. We need to connect. I'm like, okay, come on in. Let me check you out. Usually it's been, 9 months to a year since I've seen him. And so he would come in. I would do a full comprehensive evaluation. All billable to Medicare, all covered services. These are the things that require the skill of a physical therapist. Then I would put together a comprehensive program, not just a physical therapy-based program, but a program in this gentleman's case, and I think most people we work with, that includes some what I call sleep hygiene, sleep training, better quality sleep. He has sleep issues. I think most people with persistent pain have some sort of sleep issues. Look at some sort of mindfulness component, whether it be meditation or something that helps the individual deal with other factors, including persistent pain, anxiety, other issues. Look at nutrition. Right? Everybody, myself included, as I sip my latte, we need to eat better. We need to sleep better. We need to manage stress a little bit better. So as I put together a comprehensive program, and then I look around at my team And I say, what are the resources available? We have 2 amazing massage therapists in our building. I don't think he needs a 60-minute, therapeutic massage where he takes off his clothes and meditates and lays on a table and all that stuff. I think he needs more of what I refer to as a restorative massage. We typically do it in the gym. We do it before or after a workout. We do it over the clothing. We might lay on the treatment table, but typically it's done either like in sitting, leaning forward, or some other kind of more functional position. And it's like a 15-minute, 20-minute max massage that's focused on restorative, regenerative, tissue repair, tissue health, soft tissue, desensitization, that kind of stuff, right? And so a package for him. I do the initial evaluation and produce the plan of care. That's a covered service by Medicare. Typically, it's 60 to 90 minutes and billed out as CPT codes. In addition to that, if we provide any other service, like maybe I have my LMT do the therapeutic massage, the restorative massage on him, that is a self-pay service. That is not a covered Medicare service because it's done by an LMT and it's not medically necessary. It's just a nice perk. It prepares the tissue for work. Maybe we look at some other things, like I do a lot of video consultations, I do a lot of video recordings, I provide home exercise programs in a video online format. I don't like to feel like I'm nickel and diming my client, so I want them to pay a price, a reasonable, fair price, but then grant them unlimited access. Now, we know Medicare doesn't cover services without my direct on-site supervision, whether it's rendered by my PTA, or it's unsupervised in the clinic, or I'm providing billable service to another individual while I'm generally supervising this individual. So the total package would look like this. Treatment number 1, I do the evaluation, I render 3 or 4 units of active one-on-one treatment, typically like functional training, get the workout in, teach them new exercises, coaching, education. Then I might have my LMT come in and do a 15 to 20 minute soft tissue treatment. That part's self-pay, the other part's covered by insurance. The entire cost for the first session, day 1, is about $250. Then we're looking at a $200 open access, unlimited access membership to the facility. Now, it's not required. I'm not forcing him to do that, but this is what I'm recommending. So he can come in 5-6 days a week and go through his program under general supervision, not billable. Then we have the remaining 5 sessions with the LMT, and we'd be looking at another wrap-up session with me, partly billable, partly self-pay. Now we have a total package ranging anywhere, depending on the person, between $1,000 and $1,500 for a month. To him, that's a drop in the bucket, but think of the value. Guys, I gotta go. My kids are here. I'll catch you on the next video.